Guys, welcome back to Medical Coding with Blue. It is Answer Monday. So I am totally pumped about today's episode, and do you know why? Because there are so many new things that I brought up in this particular episode from last week. So I wanted to go ahead and break down a little bit more. I'm going to take a little bit more time on this episode to explain myself. I will be leaving the answers down in the description box below. These exercises are not official, y'all. This is just me as a veteran medical coder, and I'm just sharing what I know. A lot of times we, as coders, sometimes have a hard time connecting with other coders that we want to ask questions to. So at least this way we can all just sort of talk it out, and there's never any judgment. If you guys have questions, please ask them, because there's no way that I can help if I don't know what your question is. And if you ask questions, please be very specific, because generalized questions is not really going to help me know what exactly I need to explain, or how do I need to explain it, because I'm all about explaining things, but I need to know specifically what the issue is. All right, so with all of that in mind, if you have a 2017, 2018, or 2019 CPT book that you used for these exercises, you should be good to go. If you have a 2018 or 2019 ICD-10 book, you should be good to go. If you are using any other years other than those, and you come out with something different, that's probably why. These codes get updated all the time. So sometimes codes get deleted or they get revised. So just please be sure to keep that in mind. All right. So I will be including the answers down in the description box along with my email address. Okay, so let's go ahead and get started. Number 1, the patient is a living kidney donor. The patient's left kidney was harvested by open kidney removal. For the diagnosis, I got Z52.4, and for the procedure, I got 50320 with an LT modifier. Now, what happens when a patient comes in and there is nothing wrong with them, but they are there to donate an organ? So you would look under donor, and there's a very specific list. Sometimes it's bone, sometimes it's skin, things like that, where it's talking about living donors. So be sure to really look at those in that section. The Z52.4 is considered a first listed diagnosis only code. So be sure to, when you're looking up those codes, to look that up and make sure that you are sequencing properly. But if that's the reason that the patient is presenting for care, that's going to be your first listed diagnosis. Okay? Okay, next question. The patient has an acquired cyst on their right kidney. An excision of the cyst on the right kidney is performed. I got N28.1 for the diagnosis and 50280 with an RT modifier for the procedure. And sometimes when I'm wording these, I will word them in a way that's not specific to the book, but this is when your vocabulary, like an expansion of your vocabulary, is really going to help when you're trying to find similar words. So just something else that I should have mentioned, but I wanted you guys to see if you could catch that, okay? All right, number 3. A 33-year-old female arrives with chronic right side obstructive pyelonephritis. Insertion of an indwelling stent is performed by ureterotomy. I got N11.1 for the diagnosis and 50605 with an RT modifier. Okay. Number 4, a 64-year-old male has severe bilateral osteoarthritis. A left-sided total knee arthroplasty was performed with assistance of Mako, M-A-K-O. All right, I got for the diagnosis M17.0. The procedures, I got 27447 with an LT modifier and 20985 for the Mako. Now, let's get into this one, because I did get a very good question and it makes sense. So the diagnosis, because the patient came in with bilateral knee osteoarthritis. If the patient is presenting with a bilateral condition and they are only doing surgery on one side, you are still going to code for the bilateral condition, okay? Because technically the patient has it in both knees. You would not code the left and the right. You would only, if the documentation is there, you're going to code the bilateral condition. Now, partial and total knee replacements, when it's documented as the patient had a partial knee replacement or the patient had a total knee replacement, they are referring to one knee. There is two separate entries, okay, when it comes to arthroplasties, okay? And whenever we talk about a arthroplasty, we're talking about, or knee arthroplasty, we're talking about a replacement of the knee, okay? So just make sure that you know that as well, okay? Because that can throw you off if you're not looking at it closely, okay? So total or partial, okay? So even though they have this condition on both knees, we are referring to one side that they did the surgery on, okay? And a lot of times they'll do that for various reasons. One of the reasons being that maybe the provider wants to make sure that the patient can strengthen the one side first before they work on the other side, or maybe the other side isn't as severe as the other side that's being operated on. There's a myriad of reasons why. But yes, whenever in this scenario, I was referring to one side, a total knee on the one side. All right. And as far as the Mako goes, the 20985. So that 20985, the Mako is an add-on code, okay? So that is going to be listed always the second, and there is no modifier needed on that one because it is an add-on code. Whenever we are using add-on codes, we're not going to apply modifiers, okay? Or just remember that, okay? Just keep that in mind. So the 27447 with the LT modifier was what we were looking for the knee replacement. Fun stuff, isn't it? There was something else. Oh, and Mako. So whenever you see that they're using some other procedure or some other device or something like that and you don't know what it is, I hope you looked it up because it'll tell you what it is. Because when they were first describing this Mako to me, because this is new to my facility, when they were describing it to me, they kept saying robot, 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 because that's part of it, right? But actually, and then when another person described it, he said that they use computer, and the computer is controlling what the robot is doing, or it's like it's feeding the information to the robot so that the robot can do the work, right? So I was like, oh, okay. So that was how I was able to, when I looked it up on the internet and I was able to find it, I was like, oh, okay. So this is what it meant. But hearing everybody describe it as a robot, they're thinking about the robot part. They're not thinking about the computer part. So it's all together. Okay, so this was how I was able to find that particular code. And if you looked it up on the internet, you probably found the code that way as well. But I hope you looked it up in the book so that way you can sort of familiarize yourself. All right? So that was the answer on that one. Fun stuff, isn't it? I'm so excited about that one. All right, the next one, number 5. The patient has stones of the kidney and ureter. A transvesical ureterolithotomy, there we go, was performed. I got N20.2 and 51060. So there's stones and there's calculus. So remember, stones and calculus is the same thing. All right, number 6. I'm going to talk about this one too. The patient with gross hematuria receives a simple bladder irrigation. I got R31.0, and for the procedure, I got 51700. Now, I will talk about this one because this code is probably one of the most overused codes. So you have to pay attention and make sure that the reason that they're doing this irrigation, also known as a lavage, okay, if it is done independently, then that's something different. But a lot of times this irrigation or lavage is included in a lot of procedures. So when it is included in a lot of procedures, you're not going to pick it up because it's already included in that procedure. Now, when I get to the next one, you'll see how I was able to use that sort of frame of mind. But I want you guys to remember that the lavage code or the irrigation code, you have to make sure that when the provider is performing that it is being done, it is an independent service. It is not part of like the bigger part of the procedure, okay, or a smaller part of the bigger procedure, okay? All right. So the next one is the patient presents for chemotherapy. The patient has a carcinoma in situ of the bladder. A bladder lavage was performed first, followed by chemotherapy to the bladder. With chemotherapy, you got to pay attention because there's an encounter for chemotherapy and there's an encounter for radiation. So anytime you're working in the oncology field, please look at what the patient is there for, whether they are there for chemotherapy or they are there for radiation therapy. So the first listed diagnosis is Z51.11 because that is why the patient is coming in. If they're coming in for the chemotherapy, this is why. The next listed would be D09.0, okay, for the carcinoma in situ. And then I got 51720. And that's it. So why didn't I pick up the bladder lavage? Because it's already included in the procedure code. And how did I know that? I looked up the procedure code and I used my handy dandy coding companion. A lot of this information is also available in the like the Coder Just reference and things like that. But according to the explanation of this procedure, prior to the installation of the agent, a standard lavage is usually performed. It says it right there that the lavage is performed. So since it said it right there, you do not pick it up in conjunction with because it's already included. I know. If you got it and you're like, oh no, I did it too in the beginning. I did it in the very beginning. And that's when they taught us you've got to look at the procedure. What does a procedure entail? So, all right. So the next one is the patient has mixed incontinence. A laparoscopic urethral suspension is performed. I got N39.46 and 51990 for the procedure. Okay. Number 9. A cystourethroskopy. A cystourethroskopy, sorry guys, is performed on a patient who is suffering from overactive bladder. I got N32.81 for the diagnosis, and I got 52000 for the procedure. Okay. And number 10, the patient has drug-induced priapism. And I didn't say what drug it was either, so I don't expect you guys to come up with that. A bilateral corpora cavernosa saphenous vein shunt was performed, okay? And I got N48.33 and 54420 for the procedure. Yes. Okay, so there you go. There's your answers. So how do you think you did? I had a lot of fun with this one, like I said. I like being able to remind myself on how to do these urinary procedures because it's been a while since I've done the urinary section. I haven't worked on urology in a long time. It's been years since I've done urology, but when I have books like my coding companion, which I love, which I just got at conference. So, I love these. This is my friend. I love these. Oh my God, I love books so much. I'm such a nerd. Anyway, I'm going to go ahead and wrap this one up. I'm going to include the answers down in the description box, like I said. And also, one other thing. This week is National PA Week. So, be sure to tell your favorite PA, Happy PA week. And to any PAs out there, thank you for what you do. All right, I will go ahead and wrap this up. If you have any questions for tomorrow's Q&A Tuesday, please be sure to email me or comment below, because tomorrow will be Q&A Tuesday. All right, well, I will see y'all on tomorrow's episode. Bye.